Hi everyone, my name is EJAM Meceda and this is Health Vault, where we jump into fundamental topics about health and wellness. Today, I am joined by our doctors.
Hello everyone, I'm Dr. EJAM Meceda, a neurosurgeon at Our Lady of Lourdes Hospital.
And I am Christopher Sanchez. I'm a general surgeon here at Our Lady of Lourdes Hospital.
So, is your spine really fine? Let's unpack it. I would first want to know, what exactly is MIS?
Capital M, I, and S stands for Minimally Invasive Surgery. The usual Filipino, now down in the city, will say, yan ba yung tusok-tusok lang, silip-silip? Okay, and I will say, yes. That's basically it. Instead of cutting you up for a big operation, we do the same operation, small holes. That's it. Minimally invasive.
And when or where exactly do we apply or use these methods po?
Minimally invasive surgery has been here for several decades. Okay? And it's basically technology-based, no? In the olden days, no? Kumbaga sa operasyon, hinihiwa ng malaki yan eh. Big operations, you know? But now, because of technology, we use smaller incisions, we use telescope, we use a lot of technology like MRI, CT scan, ultrasound. So you will say, high-tech ba yan? Yes, it's high-tech. Minimally invasive because, for example, to get a small buccal or tumor or even a foreign body, you have to carry it up. Now, we can use telescope, we go in. So it's applicable to almost any disease now that will need an operation. So no more big operations, small holes, recovery is faster. Diba?
I would add na very important yung small holes is just the technique of doing the surgery. But the advantage of having this is what we call ERAS. ERAS, or early recovery after surgery. In the open technique or open surgery, the patients will have to stay maybe several days or a week in the hospital. For MIS, the next day they can go home. So that's...
they can even play golf now, according to the American.
They can go back to work.
Yeah, go back to work.
The downtime is really very, very small.
Every day, every week, a new instrument, a new technology, maybe audio, visual, laser, whatever, new equipments keep on coming in. But the basic, minimally invasive equipment and apparatus and the specialists who will perform the surgery are available in Our Lady of Lourdes.
So speaking of specialists, I'd want to ask our doctor here, spine specialist doctor, what exactly is a spine surgery?
Oh, okay. When you say spine surgery, that's very general. So when you say spine, it's from the neck going down to the sacrum. This is the sacrum, lumbar spine. So the whole thing is spine. And when you say spine only, it refers to the bony element. But as a neurosurgeon, I also manage the brain and the spinal cord and the peripheral nerves. So that's the main focus here. Not only the bone, but the neural elements, the spinal cord and the nerves. So we can now take out any lesion compressing the spinal cord or the spinal nerve roots with very, very small incision, 1 centimeter lang. It's available in Lourdes Hospital. So if this is the spine, this is the skin, I just go inside and duck there. I can use a specialized long forceps and go inside and take out anything there, like a disc herniation with very minimal disruption of the normal anatomy. So, hindi na kailangan tanggalin yung malaking buto. So, even the incision. That's why the recovery period is really, they go home within 24 hours.
It was several centimeters. You had a big one. Now only small one.
That's awesome. I hope I would not need it, but
Oh.
I'm happy to know that the technology exists in Our Lady
Especially
of
for
Lourdes Hospital.
athletes.
For a short period of time, you're exposed to a lot of stress. I mean, the loading in the spine compared to the normal population, you're more prone, susceptible to these injuries.
Yes, I'm
So-
quite aware.
I have a lot of athlete patients. They go back to their normal training routines after the surgery.
Yes.
So yeah, correct.
So speaking of surgery, who exactly needs it, and when do you, or what do you recommend for athletes as well? Like, is it the same approach or is it quite different?
If I get a patient, I will have to get the diagnosis first and discuss with the patient the possible options. First, we have the non-surgical management. Then later on, we have the minimal invasive. And if necessary, we will do open with the minimal invasive concept.
I did have a nerve ablation in my facet joints. That was back in 2020.
That's also a minimal invasive procedure. It's just a small injection, needle-like, right?
If I'm understanding this, Doc, so MIS is basically a concept of
Yes.
trying to do the surgery as minimally
Minimal as
invasive.
possible.
So it's not just about the size,
Yes.
it's
correct.
also the approach.
So not only the downtime or recovery period, although that's the most important thing, the hospitalization cost also is lowered, and then the complications are also lowered. I think that's very important. Blood loss, very minimal. I mentioned already hospital stay. Medications, pain medications after surgery. They can go with just paracetamol.
Wow.
Yeah.
So to the people that would undergo or have undergo these type of procedures, what does recovery looks like? How much different is it than it was before?
For general surgical cases, very common naman yung appendicitis, gallbladder removal, in OB/GYN, that's their ovarian cyst, okay? You cut it down to 20-25% of the time. In open, traditional surgery, maybe they go on leave for, let's say, for medium operations, half month. Now it's cut down to maybe 10 days or a week. It's a much shorter leave. And SSS...
I think they would want a longer leave.
Bouncing back to your specialty, spine, would you have any tips to our viewers on how to avoid, as much as the technology is here,
Yeah.
how to avoid overuse and all these things?
That's definitely more important sa viewers natin is how to prevent. Okay? So, prevention is definitely, you have to listen to your body. Number one. Number two, you have, when you do some, especially for athletes, you have to prepare your body before you do stressful things, right? 24 hours, no exercise at all, then suddenly, magkakayayaan, oh, run tayo, merong run, 21 kilometers, boom! So, they get injuries. So, it's not recommended to do that. You have to train for this. There are ways of proper lifting, proper sitting, proper way of lying down and standing. The minimally invasive surgery and minimally invasive spine surgery, available po ito dito sa Our Lady of Lourdes Hospital. Welcome po lahat na pumunta dito para magpatingin or magtanong.
Well, as far as general surgery, we are the more common for your gallbladder, for your appendix, for the OB/GYN, for your uterus, for your ovary. We do have the services of MIS, and additionally, Lourdes Hospital has packages, special, and I can say, compare it to the other hospitals in Metro Manila, it's quite affordable. So, if you want to inquire, just call want to have your appendix removed, gallbladder removed, or any other organ, we may even find a way for that. We will find a way to accommodate you, whether you're self-paying or you have an insurance to back you up.
Don't forget to like, share, and follow Lourdes Hospital on all their socials for their latest updates and posts. If you have any questions about your health, feel free to leave us a comment down below. Thank you, Doc EJAM and Doc Christopher, and to everyone joining us on this episode of Health Vault. Maraming salamat po. Thank you, Doc.
Thank you very much. Thank you.